Good afternoon, and thank you for joining me for our update on the pandemic here in Erie County. First of all, I want to wish everyone a happy St. Patrick's Day. As St. Patrick's Day was approaching, I couldn't stop but think about last year. At this time, as this pandemic was unfolding across the globe and across this country. 1 year ago tomorrow, I was seated at a conference table at the Erie County Department of Health. We were at what we called the Emergency Operations Center that we had stood up days before. There was charts all around us, TVs on, news articles in front of us, many people bringing facts and figures forward as our team diligently prepared and planned. And then it happened. The privacy door to the room opened, intercepting everything that we were doing at that moment as we heard the words, "We have our first case." COVID-19 had now crossed the borders of our county and was now part of our future. In a matter of moments, things changed. We arranged a press conference to make the announcement to the public, and I even remember we've been working to try to find a translator to do sign language for us, and as we were standing there and I began to speak, Mark ran up from the side. I'd never met Mark before, and started signing right away. He jumped in to get the work done that we had asked so that every resident in our community could hear what we were saying and understand what was going on. Unfortunately, Mark can't be with us today, but as you know, he's been with us and beside us this whole entire year also. Now, many of you might recall the story of Captain Chelsea Sullenberger, or Sully as he's often known, the captain of the airplane who famously landed Flight 1549 in the Hudson River on January 15, 2009. The aircraft, as we know, was struck by birds and lost both engines, and in that moment, Sully had to make an on-the-spot decision to save the crew and every passenger aboard. The crew alerted everyone to brace for impact as the ace swiftly navigated the unprecedented situation. The only course of action that could produce any hope of survival, he estimated, was to attempt to land this aircraft into the river lining the largest city in the United States. Afterwards, a thorough investigation ensued, and they tried to find errors in his decision, and they used several simulators to try to prove his error. But at some point, Sully spoke up and said, "You are looking for human error, then make it human." This wasn't a video game, it was life and death. Well, now no one in this country, no one in Erie County could have truly trained for the incident that we had happening here on March 18th of 2020, because it had never happened before in any of our lifetimes. Much like no one specifically trained for the incident of COVID-19, but over the years, we have done our best to make swift and smart decisions to save and protect the residents of this community. I remember a number of stories, but I think the actions of the people of this community collectively, but led by so many at the Erie County Department of Health, has really led to us being where we are today, with many lives lost still, but many lives saved. There was one early story, because things would be flying at us, things that we were trying to figure out in the moment. How do we address these things that are happening? So we were alerted that there was a European ship that was coming to the docks of the Erie Port Authority. And it was headed from a high incident country in Europe, one that had that high incident rate of COVID-19. Had 16 crew members aboard. They had left way before everything had been shut down. They could have been contagious, but none were symptomatic at the time. So we immediately took actions, and we planned and communicated. We alerted our hospitals that they could potentially have a number of COVID-19 patients in there, and our community partners, and we did everything we could to not only protect our community, but also to protect those people on that ship. There were language barriers that we might have to deal with. And so with the help of the United States Coast Guard, the United States Customs, the Port Authority, and more, the ship's arrival went smoothly, and no one ever got off of that ship, and our community was kept safe. Now, I tell you this story to just tell you one little nugget of so many of the things that have happened this past year. And it's only collectively, under the tireless direction and leadership of our team at the Erie County Department of Health, and then assisted by teams from emergency management, the Sheriff's Office, Veterans Affairs, procurement, and really the library and so many others, we in Erie County made it our mission to protect the health and safety of every single person in Erie County throughout this pandemic, as we do every day. As we know, it's been a year of heartaches and disappointments. It's also been a year of miracles and joys. And it's been a year for all of us to look back and to think about what our priorities are and to maybe live life a little bit differently. But it's been difficult and it's been challenging for many different reasons. But we know that we in Erie County, just as Sully couldn't rest until every passenger was safe, we, and myself included, will not rest until we have done everything we possibly can do in Erie County to keep the citizens safe here and to make sure that this virus is once and for all eradicated from Erie County. So today, we recognize that we are 1 year into this pandemic with our first case, but we know that we have yet some time to go, but we do see some light at the end of this tunnel. So today we have 38 new cases to report and 1 new death, which brings us to that total cumulative positive cases as of last March 18th of 18,186 and a total of 447 deaths. The positivity rate for Erie County is 8.7% from March 5th through 11th, according to the Pennsylvania Department of Health. And as of this morning, there was 20 individuals in the hospitals of Erie County with 1 person on a ventilator. Vaccines are happening, many clinics happening throughout our community. And I ask, and we all ask, that when it's your turn, you take the opportunity to get that vaccine. I urge all of you to do it for not only your own safety, but for the safety of this community as a whole. Because until everyone in Erie County can become fully vaccinated, we will continue to have to take so many of the mitigation strategies that we've been doing. We have to wear our masks. We have to cover our nose and our mouth with it. We have to stay away from people that we don't live with. At least stay 6 foot away with a mask on. We have to wash our hands frequently, and we have to, of course, stay home when we're feeling sick. So we want to get to the point where we can again gather together with our loved ones, with our family, our friends, and with the community as a whole. But it's going to take, again, that collective effort for all of us to do that. And I can tell you, we in county government are going to continue to do our best to protect everyone until the point when we can say it is safe. We can now go back to life as maybe we knew it before the pandemic. And now I'd like to ask Melissa Lyon, our Director of the Erie County Public Health Department, to give us an update on quarantine particularly, but an update from the Health Department. Melissa?
Thank you very much, County Executive. So for today's press conference, I as well was asked to reflect on the 1-year anniversary of announcing the first COVID case in Erie County, which the County Executive has mentioned was March 18, 2020, and to speak to the work that was most rewarding throughout the pandemic. Honestly, there has been extraordinary work led and championed by every single Erie County Department of Health employee, that it was difficult to select the work that has been most meaningful. But since I'm going to discuss quarantine updates and the continued importance of testing, I've chosen to retell a few quick stories around the quarantine and isolation unit that we implemented early on in the pandemic. It became quite obvious early on that a secure and confidential quarantine and isolation space was needed. If we were going to ask someone to quarantine if they were exposed to COVID positive case, or isolate if they were positive for COVID, we also needed to ensure it could be done safely, away from family members and household contacts to keep them safe from exposure. Many times that was not an option for residents or visitors to Erie County. The first story I want to tell is about an over-the-road truck driver. The individual had begun to fall ill and was instructed by the parent company to get tested. and not travel until the test results were received. Unfortunately, the test results were positive, and the individual was instructed again to isolate in the place, which was Erie County. The individual had no friends or family in the area, and therefore we were offering them the quarantine and isolation unit. The Erie County Department of Health staff and the quarantine and isolation staff quickly became the network for this person who was becoming increasingly ill and was eventually hospitalized. It was the work of the staff that stayed in touch with this person and their family in their time of need that makes me so proud of our efforts. I'm happy to report that the individual was reunited with their family after recovering from COVID-19. The second story, or multiple stories, we had the opportunity, the option that we were able to afford for positive cases or contacts of positive cases that lived in what we call multi-generational homes. I am confident that having access to separate locations to quarantine and isolate prevented additional cases of COVID and potentially prevented severe illness for those families, because we were able to offer them a quick solution so that they could quarantine and isolate safely, and that protected their families and loved ones from additional exposure. The Erie County Department of Health quarantine and isolation staff would also mention how much they enjoy learning about other people's stories, and we're grateful to be helping in such a significant and meaningful way. It is a difficult decision to make to quarantine or isolate away from family and social ties. The Erie County Department of Health staff made this experience as comfortable as possible. So I wanted to talk about quickly the update that came from the state health department regarding quarantining. So for anyone that is asymptomatic and fully vaccinated, they no longer have to quarantine as long as they remain asymptomatic. So a fully vaccinated person is 2 weeks following the receipt of the second dose of their series, or 2 weeks following if it's a single dose vaccine, and that they have remained asymptomatic since the current COVID-19 exposure. So the date of vaccination is actually day 0, and it's 2 weeks post that second dose. So if the person meets all of the above criteria, they're fully vaccinated, have no symptoms, they do not require quarantine. If the person is not fully vaccinated and they have been exposed to a positive individual, they will have to follow the quarantine requirements as reported before. I have one other announcement today. So this afternoon, I was notified that there is one Erie County COVID-19 case that is tested positive for the UK variant B117. The sample collection date was February 18th, and the report date was March 15th. The Erie County Department of Health has prioritized this case for an additional investigation to obtain the details about where the individual may have been exposed to the variant. For public health purposes, we want to know if there was international travel or exposure in the U.S. to an international traveler who had COVID, either symptomatic or asymptomatic. If there was no international exposure, then we'll have to assume that it was community acquired, which means there's likely more of the variant in our community. Unfortunately, we have just learned of this case today. We do not have complete details to fully understand this case. However, it is not a surprise that the variant disease has been identified in Erie County. It was only a matter of time, and it is possible there is more disease caused by variants that are not being identified at this time. We know that the UK variant is more easily spread than most COVID-19 viruses, so this emphasizes the need for vigilance on masking and distancing and getting tested if you exhibit any COVID-19 symptoms, such as cough, sore throat, congestion, runny nose, muscle, body aches, headache, fever, nausea, chills, etc. So a list of testing sites can be found at www.eriecountypa.gov/COVID-19, and then click on the icon that has testing. That's my update for today, and I hand it back to you, County Executive. Thank you.
Thank you very much, Director Lyon, and I wanted to say it's truly been an honor to work beside you this past year, and I want to thank you in particular for your just continued dedication and work. This has been a very stressful year for everybody, but I think particularly for Director Lyon and her team, and I can't say thank you enough to all of them. We're going to now turn it over to the media, and we're going to start today with Erie Times News. David?
Thank you, Kathy. Let's talk about this first case with the UK variant. Melissa, if you could, what I heard, and your voice was going in and out a little bit on I couldn't hear it. Was the test done in February? Can you go over that again? When was the person tested, and when was the report? Can you take me through that timeline again?
Yeah, sure. The collection date for the sample was February 18th. The report date was March 15th.
Meaning it was reported where? To and to who?
That's when the report, it comes to me in a spreadsheet as a report on the 15th, which to me would be the state health department, because then it gets pushed to us after the state health department received it.
Okay. And then just one quick follow-up on that. So how does the follow-up on this differ from the cases that are not variants?
So the primary questions that will be asked will be around any international travel outside of the United States, or exposure to anyone that traveled outside of the United States. So if we can determine, was it potentially community acquired, or was it truly exposure to someone that had been internationally traveling, or they themselves had been internationally traveling.
All right, thank you.
Welcome.
Thank you. We'll go to Joel with Talk Erie.
Thank you. Happy St. Patty's Day, County Executive. Another question to follow up with Melissa Lyons. Melissa, regarding this UK variant, do we have any idea what the status of the patient is now? Are they already recovered? Are they, do they still have symptoms at this late date? What is the status of the patient? Do we have any idea?
I do not have details around any status or update on the individual that is known to have had the variant. We have not been able to speak to them directly. Voicemails have been left for that individual.
And is this timeline to be expected as far as the lag between a test and a report that the variant is present in the market?
From the report out of the state earlier, I believe it was even today, they did talk about this looks to be the typical reporting time frame, and it's not ideal. So I do know that the state health department has been in communication with the CDC to determine if there's a faster reporting strategy that can be implemented.
Thank you.
Thank you, Joel. And now we're going to go to Erie News Now.
Good afternoon. It's Lisa Adams. Just one more question on the case with the variant. Do you have any information on whether the person was moving about Erie County between February 18th and March 15th, if there may be exposures to that person?
I'll turn it back to Director Lyon.
Thank you, Lisa. Yeah, thank you, Lisa. I don't have that level of detail, and to be honest, I was just looking at my email to see if we had anything else, details that I could report at this time, and I don't. So I apologize for that, but did want to get the information out to you all as soon as possible, even if it wasn't complete.
Thank you. And just, this is very new news for all of us. It came after noon today. So again, we are trying to get the news out there, but I'm assured that the health department will continue to investigate, and we can get back to you with more as we have more information on this case. We'll go now to Jet TV.
Hi, County Executive. This is Brian Wilk. My question is, 1 year ago, when that first COVID case came into Erie County, did you have any idea about at that time that the pandemic would last this long, or so many restrictions would go into place, or do you feel that it would be contained in a quicker fashion or anything like that?
When that period of time, there was so much we didn't know. There was so much we didn't know about the virus. Of course, there was so much we didn't know about what this future would be for us this past year. When we actually did the stay-at-home order, a little bit later in the month, it was only until early April, the stay-at-home order originally. So I think many of us thought this would be a short time period. There was just so much we didn't know. So no, none of us could have predicted the fallout to our businesses, to our students, to our schools, to our communities as a whole, to our elderly. There's just so many assets, in fact, every aspect of our life that has been affected by this virus, and not a single one of us, I don't think, could have predicted what this virus would mean to our community as a whole. And as we know, it's been extremely challenging, tumultuous year, constantly changing, and the best thing you can do this year was to be as flexible as you could, to respond as quickly as you could to whatever was thrown in front of you. Thank you.
Thank you.
We have West County Journal with us, I believe, today. Sandy, are you there?
Yes, I'm here. Happy St. Patrick's Day, Kathy.
You too.
I wanted to touch base with, it seems to me that the results for some of the recent testing has been really low. Is that due to sort of the focus on the vaccine and less on the testing, or what do you contribute that to?
Well, I'm going to let Director Lyon speak to this because I know she has some very strong feelings about testing at this point. So, Melissa?
Thank you, County Executive. I do worry that we changed our focus to vaccine, which is a very important portion of our recovery out of the pandemic. I see this as a three-leg stool. There's testing, and then with testing comes quarantine and isolation, which we can contain disease, and then vaccination, which technically prevents the disease symptoms, and then also mitigating how much disease is spread in the community. I am a little concerned that we've took our eyes off of the importance of testing, and I want the community to remember that testing is so important, especially with the concept of the variant now here in Erie County being identified. We do know that it spreads quicker and more easily, and that this could end up causing more cases of COVID-19 in the community, as well put additional strain on the health system, and that's really what we're trying to prevent. They have said that nationally, 10% of the cases are now variant B117 related to the UK, and that's about a 1% to 4% now. So 10% of them are that. So I am concerned, and I would like to really stress that individuals that feel that they are experiencing any of the COVID-19 symptoms do seek out a test. And again, we have it listed at the website. All of that should be free, easily accessible testing. So, however, to answer the question around, is this unique to Erie, Pennsylvania? It is not. We are seeing this at the state level as well as the national level. Our percent positivity rate's higher than I would like to see. What that could mean is that we're actually testing the right people, so that would drive your positivity rate up to about 8%. I'd like to see us down around 5%. That makes me feel a little more comfortable as a public health director. So if anyone's feeling symptoms, please do seek out getting testing. Thank you for the question.
Thank you, Sandy. And again, you can go to eriecountypa.gov/COVID, and you can find the icon right there for testing, and it lists all the places in Erie County that you can go and get testing, the times, the dates, phone numbers. So use that resource if you have any symptoms. Thank you. We're going to go back to David with the Erie Times News.
Thank you, Kathy. And I want to go back to the case with the variant. Melissa, so if this case tested positive in February, was there contact tracing done on this specific individual back then? And do we know if there have been any cases tied to that case?
That's a really great question, David. So it would depend on when that case came into the NED system. And so I asked that exact question of the contact tracing team if we had done an initial investigation on that. I'm not sure if they were tested in Erie County, if they were tested outside of Erie County. So there's still a lot of details that I don't know about this particular case. And, I contemplated back and forth coming out with the information, but I knew that it was really important that the community know that the UK variant is here, and the details of that are going to either be lagging, and some of those details may not even be able to be shared. the most important part for us to determine is, was it community acquired or was there exposure to international travel? Thanks, David.
Sure. And then the one thing you said, you had left a voice message with this individual. Can we then say that this person is alive? It's not someone who's died from COVID?
I believe that they were left a voicemail.
Okay.
Thank you. And we'll go back.
Nothing to indicate that person has passed away.
It doesn't. I don't believe that person has passed away. There's no indication to us at this point. But as we said, there's a lot of investigation that still has to be done. This came to us afternoon today, so it's very, very new information. And again, we're just trying to be as open and transparent with the community as we can, and informative, which is something we've tried to do for the past year. Hopefully, we'll have much more information to give you in the next day here. Talk Erie, Joel.
Yes, another question for Melissa. I'm going to pivot to the vaccine. How well do you feel that Erie County is prepared for having all of Phase 1A at least scheduled by March 31st for the vaccine per the Acting Health Secretary's order?
I think that the hospital systems and the providers are able to get individuals scheduled for those, in the 1A that want to get the vaccine. I don't think that it was ever a capacity of being able to take their name and contact information and schedule them. Where we've been hesitant is scheduling without having vaccine on hand. So we never wanted to schedule and then cancel those schedules because we didn't receive enough vaccine to immunize those individuals. So knowing that they've asked that this be part of the governor's order and the secretary's order to get them scheduled, I'm confident that the community providers will do that. And then we have to count on the state to make sure that the vaccine arrives here so that we can get those individuals vaccinated. Thank you.
Just a quick follow-up. So what is the state telling you regarding the adequate supply of the vaccine to complete 1A? Like, how quickly would it be done? Are we talking about all of April or earlier than that?
The concept that they had communicated to us was the week of March 22nd, which will be next week. The order that is received on that week will be our standing order moving forward. And I don't know if that's into perpetuity or if vaccine becomes more available, will they increase that amount? But at least we'll have a consistent weekly amount that we know, so that will help for the planning. Once we know that, we'll be able to determine more accurately if we'll vaccinate all of them in April or if this bleeds over into May, which I would hope it doesn't. But that's what we're facing right now. What's the vaccine and how many people want vaccinated? Thank you.
Thank you.
I think one of the struggles with 1A is you really don't know how many people are in it because you can pretty much estimate how many people are 65 and older, but how many people are within that 16 to 64 age group who have a pre-existing condition is a much more difficult number to estimate. So once those people get signed up, we'll have a better idea, I think, Joel, for you and others as to how quickly, and once we know the amount of vaccine coming in, we'll know how quickly we can get through 1A and move on to 1B. We will now go to Erie News Now.
So by our dashboard today at Erie News Now, we're inching toward having 33,000 people vaccinated here, 12% of the county, and that puts us ahead of the state, which I think is at 10% now. And I think with people seeing the vaccine roll out and getting excited about being able to start to, see some of these restrictions lifted, just anecdotally, last weekend, I noticed lots and lots of cars parked outside of restaurants in our county. The number of cars looking like more than what would be 50% occupancy there. So I'm just wondering, for both of you, are you excited or fearful about what happens on April 4th to lift the restrictions on serving alcohol and move to 75% indoor dining? Do you think restaurants are abiding by what the rules are now, and will they, will that be risky at this point when we still are only at this 12% vaccinated?
I'm going to let Director Lyon take it first, and then I'll come back and also reply.
Thank you for the question. And just to clarify, the 75% indoor dining is for those that have self-certified. If they've not self-certified, they are expected to stay at the 50%. I am ecstatic for the establishments to be able to move into having greater occupancy at their restaurants and eating establishments and drinking establishments, because they have really taken a huge hit through this pandemic. So for them, I'm excited. Comparing the amount of vaccine that's been distributed, or those that are fully vaccinated, and if 12% is the number we want to talk about, we need a lot more individuals to become vaccinated. That's clear. Will we likely see additional cases resulting in the loosening of the restrictions? I think that's likely to happen as well. Again, if they remain manageable, which in the past month or so we've been manageable because we have a comprehensive disease investigation and contact tracing staff that's been on board and really dedicated to this, and the numbers have been staying in the double digits. I like to see them, and if we can keep them in the 20s, that's great, but we can manage quite a bit right now. So again, understanding that cases could increase, but we have resources and expertise in place to do rapid disease investigating and having people quarantine, appropriate isolation. And if all of that is followed and people are compliant, I think we can continue to move in this direction and we'll be okay. I don't ever want to say that there isn't risk for all of these activities, because there's just inherent risk. The more times and the more people that we get together in settings, the more likely we are to have increased cases or spreading disease from person to person. So really important, participating, making sure that we're staying masked throughout the process, and also good hygiene. And then when you are there, keeping your distance is still very important. So I don't want anyone to lose sight of those things. If we can do that, I think we can balance it and we can move through. I hand it back over to the county executive for anything additional she'd like to add.
Thank you, Director Lyon. I think you answered a lot of it, but I will say also, many of these businesses have really struggled to stay open. A lot of people have tried to support them through takeout and other ways, and we've tried to support businesses through county government with some of the funding we've gotten through CARES Act and other means to support these businesses and try to keep them alive. I look forward to the day when I'm comfortable enough to go back out to a restaurant and sit down and eat. I'll be really happy when we can move to the 1B and restaurant wait staff and cooks and people like that can also get vaccinated, because they really are at risk with all the different people that come into the restaurant, take off their masks, of course, to eat. So every person's got to weigh their risk, I believe, before you decide to venture out to a restaurant or to some other place like that. But it is nice to know that we are beginning to open up a bit more and have a little bit more normalcy, and our businesses hopefully can maybe make a little money and survive through this very, very difficult time. Thanks, Lisa.
Thank you.
Brian with Jet TV.
Hi. With the news of the new variant here in Erie County and its reputation of spreading very quick, what's your main concern, County Executive? Like, possibly that the county possibly that we're opening too soon, or maybe an emphasis that people really need to continue those social distancing measures?
I think my main concern is that people are going to get too complacent. We still have said that no matter whether you've had a vaccine or not, you need to wear your mask when you're out and about and away from your home. In county government, it's a policy. Everyone has to wear a mask when they're on county grounds, outside or inside, unless they're in an office completely by themselves, and only while they're in there by themselves. So these are the things that still need to happen. And so I think that my concern is always that people will think, wow, it's almost over, we have a vaccine. But as was mentioned, we have a very small percentage of the people vaccinated, and still a fair amount of virus circulating. We have more virus circulating through the community today than we did early fall last year. And so we are certainly not out of the woods yet. And if this variant or any other variant takes hold in our community, the numbers could spike up again. So back to Director Lyons saying testing is important. If you feel any symptoms, please stay home, monitor, and if the symptoms persist at all or any of the symptoms listed on our website that are of concern, please go and get tested. It's very simple, it's very easy, and it will give you peace of mind and those you love peace of mind and help our community stay safer.
Thank you.
And now we'll go back to Sandy at West County Journal.
Hi, again. What would you say to the people that are frustrated? Because I've spoken to many people that are frustrated with how the vaccine is going, how to schedule it, and they're like 78-year-olds that still haven't been able to get a vaccine yet. There's younger people that have gotten it, and I know of a couple that went out of state to get their vaccine. What would you say to the people that are trying to get the vaccine but have been unable to?
So vaccine becomes more available, it seems like, each week, especially for those in the 1A, and that's who should be getting the vaccine right now. And every vaccination entity, so whether it be a drugstore or our local hospitals or any other entity that's doing vaccine, has to now have a phone number, so you don't have to have a computer to get on and schedule yourself for a vaccine. And I know it's difficult, and sometimes you have to wait online for long periods of time, but if you are older and you can encourage someone to help you, maybe a younger member of the family or a neighbor who can assist you. Two people dialing might get through faster than one person dialing, so try different ways to do that. But please know that your turn is coming very soon, because all people in the 1A are to be scheduled before the end of this month, and that's only, of course, days away. So, and the other thing to remember about people going outside of this state, it's okay. It's a federal resource, so it's really for all residents of the United States. So if you get your vaccine, I know people who've told me, well, I tried to go on one of the drugstore chains to get my vaccine, and they sent me to someplace in Ohio. That's okay. You can go there. Or people told me they went to Mercer County and got a vaccine there. So it's okay, but I know that's obviously a hardship for many people in terms of the drive. So just keep trying. There's more and more clinics that are being taken into the outer areas of the county so that we make it more accessible to everybody, not just keep it in the urban core. And so that is also expanding. And if you can't get on a computer because you maybe don't have a computer or don't know how to do that, again, maybe ask someone who's younger in your family to help you navigate that so you can see all the different places where the vaccine is available, because there are many. Thank you, Sandy, for that question. And now we'll go back to David, Erie Times News. Do you have a final last question?
Did Sandy have another question? She can.
Oh, I'm sorry, Sandy.
Well, thank you. I just wanted to follow up with, if someone goes out of state, or does that affect the numbers in Pennsylvania of those that have been vaccinated? And is that an issue, or is it?
I'm not sure how that's. I'm going to ask Director Lyon to answer that, because I'm not exactly sure how that affects our numbers.
Yeah, to my knowledge, if someone does receive a vaccine that is out of Erie County, so they go out of Erie County to receive their vaccine, it should get reported to an Erie County vaccinated individual, which, interesting, we were just talking about it today, that our numbers won't always match up, especially if someone comes into Erie County and gets vaccinated here and they live in a different county or maybe a different state. That number goes to that state or county as being fully vaccinated. So it's a very fluid movement around the vaccine. And then if you can imagine, if you're translating that information across state borders, it's going to have a significant delay. It'll have a little bit of a delay across county borders. So I hope that answers your question, Sandy, that technically in theory, it should report back to us at the county level, regardless of where they receive their vaccine, but there might be a lag.
Okay, thank you.
Okay. We are running short on time today, so I think I am going to wrap it up. I hope we got to answer most of your questions. But I am going to end with one-star business, which is perfect for today, and that's McGarry's Oakwood Cafe on West 38th Street. And they're doing a great job there, offering dine-in and curbside and delivery for all patrons. They have built-in wooden plexiglass enclosures to make each dine-in table more private and comfortable for all of its customers. And they also frequently disinfect high-touch surfaces, distribute single-use items for tables, and conduct daily employee screenings. One key mitigation measure that they implemented is to have someone outside monitoring the door to ensure that crowding is minimized and waiting for a table is streamlined. So they are confident they are ready to serve you for St. Patrick's Day for your favorite Reuben sandwich or whatever your choice might be for today on St. Patrick's Day or any day. And I encourage you to continue to support our businesses in any way you can so that they are here when the pandemic's over and we can all be out safely. I again want to thank every single one of you who's been with us for this past year. I want to thank the media. Without you, we can't get the word out to the community about what's going on and inform people. So I want to thank you for your partnership. It's been tremendous. From QLN, who lets me do these press conferences every Wednesday safely, and to each one of you, whether paper, radio, or TV, you have truly been great partners throughout this. And of course, my huge thanks goes to my staff, the staff at the Erie County Department of Health, most particularly public safety, and many, many other staff members at county government. And lastly, to so many of our great partners in Erie County. It's been a challenging year. But as a community, I think we have really showed that we know how to come together, we know how to collaborate, we know how to work for the betterment of all, and for that, I thank all of you. So until next week, I ask you to please wear your mask. Please keep yourself 6 feet distance from anyone that you don't live with, wash your hands frequently, and please, during this next week, stay safe. Thank you.